Okay, so a quick look at the basics of the lunge. The front leg, we're trying to make sure that the heel is in contact with the floor, and as well as that the front leg, that the shin tries to remain as vertical where possible. The back leg, you'll notice that the knee should just be directly underneath the hip, so the athlete's not overextending, and that the chest is risen. So you're looking here, you can see an alternating leg lunge. So one leg steps forward, another leg steps forward. This one we've progressed it so the athlete's ready to move with a single leg lunge, so we're going to put more fatigue on one leg. To progress that further, we might look into a walking lunge. So we'll come, step together, just to make sure that that athlete can continue to step in that pattern. Progress it further with a straight through walking lunge. Common faults we'll see, so again you'll see a big overextension in some people, so they try to think that more is better, so they try to create a bigger lunge, which creates problems for that back leg and that hip flexor, the hip area. You'll also see a loss of posture in the upright part of the body. So here, leaning forward, potentially losing the lumbar spine, which is the lower part of the spine, even the upper spine as well. Some people who lack strength, you might see this, so they're trying to get that knee to the floor. In doing so, they struggle to push back up. That range of movement's probably too far for them, so they're driving back up, trying to use them hands, and it starts to look a bit awkward. Walking the tightrope. So a lot of people think that as you lunge, you try to step that leg forward almost in front of the other leg, which can create problems around balance, and especially when you start to load the body, it's not going to help. So really the ideal way from the front view is to make sure that you're not stepping directly in front of that back leg. If you're unsuccessful with their movements, just reduce the range of movement. So you can see here, the knee's not touching the floor, it's just going to where the athlete's comfortable, but making sure that we can keep the right technique. If you're doing that, you start loading the body. So maybe you start from the front. So you can see here a kettlebell, a lightweight, just to make sure that all the points of performance that were covered still there. We're a big believer in, obviously, variation is key. So again, it could have a one-handed athlete, or it could just be someone's got an injury in one side of the body, or we're just trying to load in a different way. So that one-sided kettlebell lunge. Overhead positioning, so trying to activate the shoulders, trying to show the armpits facing forward, and trying to make sure that rib cage is down. We're not overextending, which we commonly see. So here you can see a big overextension, which can create a bit of load in that lower spine. So someone's going to create or have some problems there, which obviously we're trying to avoid. So we don't load overhead if them basics are not there. Again, active shoulders. So you can see here the shoulder's not activated. So it's a poor overhead position really. Remember, we're always looking for quality over quantity. If all of the things is happening, you might even be able to progress into an overhead walking lunge. So this is kind of the final phase of the movement, what we might be looking at. Notice that the hips hopefully are coming to full extension at the top, and all them points of performance that we've spoke about are there. Just a couple of pieces of equipment that you can use, but remember, make sure them points of performance are there. If they're not there, don't start loading the body.